Hi everyone, I want to talk about urge incontinence, but before proceeding further, I would advise that you check my channel for stress incontinence. Okay, let's go. The urge is perceived to urinate. Normally, many will be able to hold it until it is convenient or at the right place. That ability to hold it till you get to the convenient or right place is lost here, and it may be as a result of overactive bladder. So that is what all urge incontinence is all about. So you have the perception to urinate. Unfortunately, it's now beyond the control of the affected individual to hold it until the right place or convenient time to void. What are the possible risk factors there? It may also be secondary to bladder wall overactivity or hyperactivity. It can be as a result of Parkinson's disease or stroke, or this is even in case of multiple sclerosis not yet diagnosed. This might be the beginning of the trouble that will lead the individual to the doctor, and through physical examination and history, with some investigations, the diagnosis of multiple sclerosis could be made for the first time. This might be as a result of spinal cord injury, but that will be obvious. The individual will have known that he or she had injury in the past, or this is as a result of Detrusor instability. You have to rule out other causes of urinary incontinence, and of course, handle the modifiable risk factors. Well, if you want to enjoy this, you need to kindly check my channel for stress incontinence. Check the video and you understand better. If medications are involved like diuretics, sedatives, and alcohol, that should be handled appropriately. Smoking should warrant discussion as per smoking cessation. If there's lower urinary tract infection, it will be wise that such is treated right now. And if there's constipation, laxatives could be used. If there's caffeine intake, that should be stopped or at least at the barest minimum. Excessive fluid intake should be decreased, particularly when you are going out. What are the possible investigations to be done? Investigations here are close to those that will be done during stress incontinence. So you can check out my video on stress incontinence. So you have your analysis done, renal function test with blood urea and nitrogen, creatinine, glucose, electrolytes, then urine microscopy, culture and sensitivity to rule out urinary tract infection. Here, in addition to everything you are going to do if this is stress incontinence, because you want to be sure this is not stress incontinence, okay? Because if it is stress incontinence, some medications you are going to use for urge incontinence are not necessary for stress incontinence. So with that, you're going to do urodynamic testing. With urodynamic testing, you might be able to measure the Detrusor compliance and contractility. And also you'll be able to assay for the value of post-void residual volume. And of course, be able to determine the bladder capacity. So the treatment here is, first of all, rule out the secondary causes. Then have Kegel exercise done and bladder training with time voiding. Unlike stress incontinence, here you're going to use medication like oxybutynin, either the gel or patch or per oral. Okay, so the phenacin, that is vesicare or toterodine Detrusor, could all be used. Trospium, trosec, vaginal pessary in urogenital atrophy, Mirabegron, that is B3 agonist, could all be used here. Botulinum toxin is not left out, and the Darifenacin, that is enablex, is applicable. Drugs that can worsen urinary retention must be washed. And if a patient or you, the listener, is on any of them, approach your doctor. Okay, because if you have urge incontinence and you are on one of these very many medications that I'm about to start mentioning, then there must be adjustment, and at the same time, your ill condition on account of which you are using any of this medication could still be addressed. So you need that, conversation with your physician. Okay, so let me start going to all those drugs one by one. Anticholinergics generally will retain urine, and that is not good in this case. I mean, urge incontinence. Okay, because when the bladder is full, the urge will come and you can't handle it. And if you're on medication that will hold urine for you, you can predict how many times that will happen in a day. And I don't want you to become excessively anxious or become depressed and be thinking of something horrible about yourself. Okay? So let's go together. Anticholinergic. Are you on oxybutynin, benztropine, scopolamine, terotene, atane, ipratropium, tiotropium, or atropine? Is these tricyclic antidepressants? Or are you on antihistamines, chlorpheniramine, phenhydramine, or hydroxyzine? Are you taking non-steroidal anti-inflammatory drugs at the moment? The list of medications that could worsen urinary retention continues as sedatives or hypnosis, that is diazepam or flurazepam. Also muscle relaxant, baclofen, or cyclobenzaprine. Antipsychotics are not left out, and also antiarrhythmics like disopyramide, procainamide, or quinidine. Are you on antiparkinsonian like amantadine, bromocriptine, or levodopa? L-agonists like ephedrine, pseudoephedrine, and phenylephrine. The list of the medications or drugs that can worsen urinary retention will continue, and on the list will be beta agonists, terbutaline, isoproterenol. Others are carbamazepine and nifedipine. Okay, if you are on any of these medications and you've been diagnosed with urge incontinence, go with this list to discuss with your doctor. There should be a review of your medication in such a way that the ailment that these medications are used for will still be under control, but at the same time will not be worsening your urinary trouble. Kindly subscribe to my channel so that you can get my presentations immediately they're published. Thank you.